Now, some sobering numbers coming from a new report from the Ontario Drug Policy Research Network showing the tremendous toll opioids are taking on the province's youth. The report found that there were 752 deaths among adolescents and young adults between 2014 and 2021, a tripling. Over the same period, 711 young people were hospitalized, with more than 5,400 ending up in the ER. The annual rate of emergency room visits quadrupled for young adults, those aged 18 to 24 by 2020. The authors say that at the same time, drug treatment rates significantly decreased. And let's now bring in Dr. Alexander Caudarella, CEO of the Canadian Centre of Substance Use and Addiction. Doctor, good afternoon, and thank you for your time.
Thank you for having me.
These numbers, like we said, are sombering numbers. Your take, were you expecting it to be this high, the fact that they have tripled?
The past years have been very difficult for people who use drugs, for their families, but every time you see the actual numbers come out, they're so much worse than people anticipate.
In your view, why do you think we're seeing this increase?
We've seen an increase in deaths, in fentanyl poisonings going on for years. And so the fact that it's happening in adults, it's not a surprise that it's happening in younger people. What it is probably more tragic and even more avoidable in those situations. We're talking about people who are often not spending decades in using drugs and are often, unfortunately, dying very early in or after they've initiated or begun it.
Indeed, because this age group that we are talking about, and what is the most alarming fact is, this age group lies between 15 to 24 years of age, very young indeed. But let me ask you, this report also indicates, sir, that treatment has gone down. The medication used for treatment has gone down by 50%. Why do you think so?
Well, this is just a failure on our part. And often we're hearing these deep ideologic debates about which way is best. I think these kinds of numbers just show that you need a full continuum of care. You need to be able to support people. I mean, in my practice, I can tell you that younger people are terrified of treatment. And often treatment or medications or any different form is not really made for younger people. It's not purpose-built, especially in that 18 to 24 group. They're thrown in with people who are in their 30s, 40s, 50s. It's not right for them. So they're either not accessing it or they're afraid. Our organization, the CCSA, has worked with Foundry, an organization out in BC, to try and demystify some of that. We have Improving Treatment Together. We have videos on opioid agonist treatment, on how things can go. But still, these are only drops in a bucket. We need to find a way not to necessarily get young people into treatment, but to make the treatment appropriate for those young people seeking help.
Well said, more appropriate and perhaps more accessible to these young people. Let me ask you lastly, sir, what else do you think needs to be done to try and prevent these tragic deaths?
We've known fentanyl's been around for a while. And if you think about the 18-year-old who's died this year, they were 10 when we really started to understand this was happening. That's an age where you can make an intervention, you can make a change, family-based, community-based, school-based supports that can help prevent problematic drug use. So I think part of it is absolutely the continuum of care, absolutely offering a full spectrum of options that meets people where they're at, that helps people, that supports their families in treatment. But I think we really have to be looking one step earlier and saying, okay, these kids that are dying now, because they are still kids that are dying, but these kids that are dying, when we started understanding about fentanyl, they were 10. And we know we have things and the programs that could have been offered at that age to them and their families that could have significantly reduced the chances that they were going to have problematic use or that they could have been exposed to things like fentanyl. And I think we really have to take a bigger picture. We have to put much more significant investments and take this much more seriously than we have. As we're seeing now, it's kids, it's adults, it's loved ones that are dying.
Indeed. All right. We leave it at that for now. Dr. Alexander Caudarella, thank you for joining us on CTV News Channel. Appreciate your time and insights.